Gender dysphoria represents one of the most profound and complex experiences in human psychology, characterized by significant distress arising from the incongruence between an individual's experienced gender identity and their assigned sex at birth. This psychological phenomenon transcends simple discomfort, manifesting as a deep-seated, persistent feeling of being trapped in the wrong body or living as the wrong gender. The experience of gender dysphoria varies tremendously among individuals, ranging from mild unease to severe distress that can significantly impact daily functioning, relationships, and overall quality of life. The manifestation of gender dysphoria often begins early in childhood, though it may not be recognized or articulated until later developmental stages. Young children experiencing gender dysphoria might express a strong preference for clothing, toys, or activities typically associated with a different gender, insist on being called by a name consistent with their felt gender identity, or express distress about their physical characteristics or anticipated physical development. These early signs are not merely phases or expressions of nonconformity, but represent genuine experiences of incongruence that can persist throughout an individual's life. During adolescence, gender dysphoria frequently intensifies as secondary sexual characteristics begin to develop. The onset of puberty can be particularly distressing for individuals with gender dysphoria, as their bodies begin to develop in ways that feel fundamentally wrong or alien to their internal sense of self. This period often marks a critical juncture where the disconnect between physical development and gender identity becomes more pronounced and difficult to ignore. Many adolescents experiencing gender dysphoria report feeling increasingly isolated, anxious, or depressed as their bodies change in ways that contradict their deeply held sense of who they are. The psychological impact of gender dysphoria extends far beyond personal discomfort, often affecting academic performance, social relationships, and family dynamics. Individuals may experience significant anxiety in social situations, particularly those that require gender-specific behavior or appearance. School environments can become sources of tremendous stress, with concerns about bathroom use, locker room access, and peer acceptance creating additional layers of complexity. The fear of rejection, discrimination, or misunderstanding can lead to social withdrawal, academic decline, and increased vulnerability to mental health challenges. Family relationships often undergo significant strain when gender dysphoria is recognized or disclosed. Parents and siblings may struggle to understand the experience, leading to confusion, denial, or conflict within the family system. Some families respond with support and acceptance, seeking professional guidance and advocating for their loved ones' needs. Others may react with resistance, disbelief, or attempts to suppress or change the individual's gender expression. These varied family responses can significantly influence the individual's ability to cope with their dysphoria and access appropriate support and treatment. The diagnostic criteria for gender dysphoria, as outlined in professional mental health guidelines, require evidence of significant distress or impairment in functioning, along with a marked incongruence between experienced gender and assigned gender lasting at least 6 months. This clinical framework helps distinguish gender dysphoria from temporary gender nonconformity or exploration, ensuring that individuals receive appropriate assessment and care. However, the diagnostic process itself can be complex, requiring careful evaluation by qualified mental health professionals who understand the nuances of gender identity development and expression. Treatment approaches for gender dysphoria are individualized and may include various combinations of psychological support, social transition, hormonal therapy, and surgical interventions. Psychological counseling plays a crucial role in helping individuals understand their experiences, develop coping strategies, and navigate the complex decisions surrounding gender transition. Therapists specializing in gender issues provide safe spaces for exploration and self-discovery while addressing co-occurring mental health concerns such as anxiety, depression, or trauma. Social transition involves changes in gender presentation, including alterations in clothing, hairstyle, name, and pronouns used by others. This process can provide significant relief for individuals with gender dysphoria, allowing them to live more authentically according to their gender identity. However, Social transition also presents challenges, including potential discrimination, safety concerns, and the need to navigate institutional policies regarding gender recognition and accommodation. Medical interventions for gender dysphoria may include hormone therapy and surgical procedures, depending on individual needs and preferences. Hormone replacement therapy can help align physical characteristics with gender identity, potentially reducing dysphoria related to secondary sexual characteristics. Surgical options range from chest reconstruction to genital surgery, offering possibilities for physical alignment with gender identity. These medical interventions require careful consideration, comprehensive evaluation, and ongoing medical supervision to ensure safety and effectiveness. The social context surrounding gender dysphoria has evolved significantly in recent decades, with increased awareness, acceptance, and legal protections in many jurisdictions. However, individuals with gender dysphoria continue to face discrimination, prejudice, and barriers to accessing appropriate healthcare and social services. Educational institutions, workplaces, and healthcare systems are gradually developing more inclusive policies and practices, though progress remains uneven across different regions and contexts. Research into gender dysphoria continues to evolve, with scientists exploring biological, psychological, and social factors that contribute to its development. Studies investigating genetic, hormonal, and neurological influences provide insights into the complex origins of gender identity, while psychological research examines the impact of various treatment approaches and social factors on outcomes for individuals with gender dysphoria. The long-term prognosis for individuals with gender dysphoria varies considerably, influenced by factors such as access to appropriate treatment, family and social support, and broader cultural acceptance. Many individuals who receive comprehensive, affirming care report significant improvements in psychological well-being, social functioning, and overall quality of life. However, challenges may persist, particularly related to ongoing discrimination, medical complications, or unresolved aspects of gender dysphoria. Support networks play vital roles in the lives of individuals with gender dysphoria, providing emotional support, practical assistance, and advocacy for equal rights and opportunities. Peer support groups, online communities, and advocacy organizations offer valuable resources and connections that can help individuals navigate their experiences and build resilience. These communities also contribute to broader social awareness and acceptance of gender diversity. Understanding gender dysphoria requires recognition of its complexity, individual variability, and significant impact on those who experience it. Rather than viewing it as a disorder to be cured, contemporary approaches emphasize affirmation, support, and individualized care that respects each person's unique journey toward authentic self-expression. This perspective acknowledges that gender identity exists on a spectrum and that individuals deserve respect, dignity, and access to appropriate care regardless of where they fall on that spectrum. The narrative of gender dysphoria ultimately reflects the fundamental human need for authenticity, self-expression, and social acceptance. By fostering greater understanding, compassion, and support for individuals experiencing gender dysphoria, society can create more inclusive environments where all people can thrive as their authentic selves, free from discrimination and prejudice based on gender identity or expression.